Good morning all. Today we are going to see about the condition congestive heart failure. So here the heart failure is a chronic condition in which the heart cannot pump enough blood and oxygen to support other organs. So here congestive heart failure is a chronic progressive condition that affects the pumping power of the heart muscle while often refers to simply as the heart failure. So here it is associated with the numerous types of heart disease, particularly long-standing hypertension, coronary artery diseases, ventricular dysfunction, reduced exercise tolerance, diminished quality of life, and shortness of life expectancy. So here we know about that in heart failure, the heart inability to pump. So next we move on the types of the heart failure. There is a 4 types are there. First one is the left side heart failure, and second one is the right side heart failure, and third one is the systolic heart failure, and fourth one is the diastolic heart failure. So here let's see one by one. In that, first one is the left side heart failure. Here fluid may bake up in the lungs, causing the shortness of breath. Next, right side heart failure, fluid may back up into the abdomen, legs and feet, causing swelling. So next one is the systolic heart failure. The most common cause of congestive heart failure results from inability to heart pump blood. It is the defect ability to ventricles to contract. So the left ventricle contract vigorously, indicating the pumping problem. There is the pumping problems in the impaired contractile functions. For example, if the patient is having the myocardial infarction increase after load, like hypertension, cardiomyopathy, and then ventricular mechanical abnormalities, these are the main cause the systolic heart failure. And the next one is the diastolic heart failure. So here the left ventricles cannot relax and fully, indicating the filling problem. It is also heart failure is result from the action of friction. So decreased filling of the ventricles, resulting in the decreased stroke volume. In diastolic failure, there is a normal systolic functions, and the diastolic functions characterized by high filling pressure, and the venous engorgement also we can see in there. In addition, diastolic failure is usually the result of left ventricular hypertrophy from chronic systemic hypertension, aortic stenosis, or hypertrophic cardiomyopathy. Diastolic failure is commonly seen in the older adults. So next we move on the causes. So first one is the coronary artery disease and heart attack. Second one is the high blood pressure like hypertension, and then faulty heart valves damage the heart muscles, myocardia. Heart defects are born with the congenital heart disease, abnormal heart rhythm like cardiac arrhythmias, other diseases like chronic diseases such as the diabetic melta, hyperthyroidism, HIV, hypothyroidism, and the these are the causes behind the congenital heart failure. In addition, if the patient is having the anemia, decreased oxygen carrying capacity leads to the congestive heart failure, infection, thyrotoxicosis, changes in the tissue metabolic rate, and so it will increase the cardiac workload, and then hypothyroidism, arrhythmia, bacterial endocarditis, pulmonary embolism, pulmonary disease, nutritional deficiency, hypovolemia. These are the cause behind the congestive heart failure. And the next one is the pathophysiology. In that we know about that causes behind this. So it will damage the heart ventricular overload, so it will cause tachycardia, and the next decreased cardiac output, decreased renal perfusion. It may lead to the increased sodium retention. Once the sodium retention is increased, it will increase the osmotic pressure also increase. So here the antidiuretic hormones, once the antidiuretic hormones secreted, here the patients may experience the increased water retention in the body. So again the fluid overload. So here once the fluid overloaded, it entirely affect our hearts, and the patients may experience the edema. These are the I think people are understand about the pathophysiology. And the next one, the clinical manifestation. Here the clinical manifestations include the patients may experience the dyspnea, which means shortness of breath, and fatigue and weakness, swelling, edema in the legs, ankles and feet, rapid irregular heart rate, reduced ability to exercise, persistent cough or wheezing, and the next increase need to urinate at night. These are the common clinical symptoms we can see in this patient. Here I would like to differentiate the clinical symptoms in right side and then left side heart failure. So here when we are seeing the right side heart failure, patient have the symptoms like fatigue, dependent anemia, right upper quadrant pain, anorexia, GI bloating, hepatomegaly, right side of pleural effusion, ascites, edema depend upon the body parts. For example, patient may have the pain in their sacral area, pedal edema. Here the patients may experience the weight gain, increased heart rate. These are the symptoms we can see in the right side heart failure. When we see in the left side heart failure, patient is having the characters like pulmonary edema. You can see here the S1 and S2 sounds, fatigue, dyspnea, orthopnea, dryness, pulmonary edema, nocturia, proximal noctural dyspnea. These are the symptoms we can see in the left side heart failure. In addition, patient is having the sudden weight gain. These are the symptoms in the left side heart failure. So next we move on the diagnostic evaluation. We have to collect the complete history from the patient, and then we have to do the physical examination. In that way, physical examination we have to assess the edema, pedal edema, whether the pedal edema is there or not, and then blood test we have to do like liver function test, kidney function test, thyroid stimulating hormone test we have to do for the patient. And then next a blood test chemical called terminal pro non-natriuretic peptide level we have to do, and an echocardium stress test. In stress test we have to measure the heart and blood vessels respond to the excursion, and then cardiac computerized tomograph, CT, MRI, coronary angiogram, myocardial biopsy. These are the investigation we have to do for the assessing the heart failure. And next we move on the management. Here first I am start with the medical management. Here the medical management first start the pharmacological. Here we are providing the angiotensin converting enzyme ACE inhibitors we are provided here. For example, enalapril, lisinopril, captopril. These are the medication we are including the ACE inhibitors, and then angiotensin 2 receptor blockers like losartan, valsartan. These are the tablets, and the next beta blockers carvedilol, metoprolol, and then bisoprolol. These are, and the next furosemide. Here choosing the loop diuretics for in loop diuretics. Here we are choosing the furosemide like Lasix, and the next aldosterone and antagonist like spironolactone we are choosing here. These are the medical management including this. Next we move on the inotropics. So here improve the heart function, maintain the blood pressure, and the next digoxin is very important. Digoxin is a heart failure medicine. So once we are administering the digoxin, we have to know about the digoxin toxicity. If the patient is having the bradycardia, we should not administer the digoxin for the patients, and then we have to assess the blood vision also. And the next non-pharmacological management, we have to maintain the input and output chart of the patient. So if we are here the maintain the IO chart, fluid retention will be there. So if the patient is having the fluid retention, the water retention in our body, so weight gain is there, so we have to monitor for the. We have to maintain the patient in propped up position, like the patient is having the breathing difficulty. So next we move on the surgical management. Here we are doing the coronary bypass surgery, heart valve repair and replacement, implantable cardiac verse defibrillator, cardiac resynchronized therapy, and the ventricular assisted device, heart transplantation. These are the surgical management we have to do there. And the next nursing management, decrease cardiac output related to the changes in myocardial contractility, ineffective breathing pattern related to the insufficiency or supply oxygen blood, excess fluid volume related to the decreased glomerular filtration rate, activity intolerance related to decrease in carbon monoxide, anxiety related to breathlessness, and then powerless related to the chronic illness and the hospitalized, ineffective therapeutic regimen management related to the lack of knowledge. So complication, here the patients experience the kidney failure, heart valve problems, heart rhythm problems, liver damage. These are about the congestive heart failure. Hope you all understand this subject. So next we'll see on the next video. Thank you for watching.